Welcome to my world. This is another time, another day that I'm going to spend doing what I like doing best. Life is about enjoying whatever you are doing and putting passion into them. That makes you happy. That makes you healthy. And like I've always said, health is wealth and knowledge is power. It is that knowledge that I have always been trying to impart, so that the more knowledgeable we are on health matters, the wiser we are. And since my mission is to really create that necessary symbiotic relationship between you, the public, you that you're watching me right now, and the medical laboratory scientists, so that we can all enjoy a better health and live happily ever after, like it's commonly said. Today's topic that I shall be exposing is Otitis Media Laboratory Diagnosis. Otitis Media is the inflammation of the middle ear, infection around that portion of the ear. It's a common infection for children between the ages of 6 months or thereabout to age 3. It's hardly almost impossible for people, any child given birth to, not to have experienced it one way or the other. At least the percentage is as high as 80% in developed world, America and Europe, that by the age of 3, a child would have experienced otitis media. The commonest of this ear infection is the acute otitis media. What is it really? The acute otitis media is that infection of the middle ear where the pus, there is that, it graduates to the, it could graduate to the effusion where the ear infection, the effusion, otitis media occurs more. Although with that otitis media, the acute type, you all usually find bacteria, different type of bacteria, and the most common ones are those resident around the pharynx, because the pharynx is that area that links with the intermediate tube of the ear. So there is that linkage. So you can find bacteria crossing over, and most time it is happening immediately after sore throat or other infection around that area, that you now find the organism crossing over to the middle ear and starting infection. Most finding usually include strep pneumonia, especially in developed world, because strep pneumo is more of the primary cause of infection around that area, upper respiratory and lower respiratory infection. But it is more of an upper respiratory infection that results in otitis, acute otitis media. It is assumed there is that strong association between that infection around the pharynx, the upper respiratory region, and later on proceeding or progressing to the child experiencing otitis media. I have also been involved in the research, especially during my master's program in medical microbiology, that I worked on it, and my finding was just that instead of that strep pneumo, what the experience was in the hospital around the Baghdad General Hospital was Staph aureus, Staphylococcus aureus, predominantly causing the infection for children around, within the ages 6 months to 3 years. That study really proves that rather than having a situation of strep pneumo being the predominant organism, I found out that it was Staphylococcus aureus that was evil, and it's a study that relate very well with other studies that have been done in this part of the world. In the western part of the world, yes, you find the strep pneumoniae. Apart from Staphylococcus, the next predominant organism in my study was Klebsiella pneumonia, and then you now find strep pneumo coming in, as well as Haemophilus influenza, even Pseudomonas aeruginosa, and Moracella cataralis. These are all bacterial infection. It is hardly you find a virus causing otitis media. Though the effusion type, you may not even see the organism. You may not be able to grow the organism. But at times, if you use the PCR, polymerase chain reaction, you will be able to now confirm that there is a bacteria causing that infection around that region. The PCR will show the genetic makeup of that organism. As like I'm saying, the laboratory is that place where you can really help to diagnose effectively and treat. Why do you need the laboratory in this aspect? Because bacteria relate differently in terms of antibiotics. The antibiotic that can cure this species of organism may not be the one that will take care of another species. But by the time you are able to do the study, collect the purulent discharge from the hair and do the cultural thing necessary and sensitivity testing, you will be able to confirm the antibiotic that will be very effective in treating this otitis media. And you can imagine children of those, that tender age are experiencing this thing. But it's not that it is limited only to children. You find adults too experiencing otitis media, but it is a very common infection amongst children, and it runs in some countries like Nigeria. You can say it's second to malaria. In some countries, it could run as #1 infection of children. So otitis media is a very common infection, and there is a need for us to understand how do the children come about it, just as I tried to explain, and what are the risk factors, as well as what we need to probably do to control that infection, and so the children will not continue to be discomforted. Like I've always been doing, I will need to have the platform of the slide to explain very well what otitis media is and all the needful things, the experience you need to know, what you need to acquire, so that you are very, very able to handle otitis media if you have a child or a relation or anybody that wants to know what to do. If you like what I'm doing, like I've always been saying, subscribe, press the like button. Subscribe. Your subscription does not involve any premium. You don't pay any premium. All you just do is just subscribe so that you are notified anytime the new production is out. Thank you. Welcome back, and this is where we start again. Otitis Media Lab Diagnosis. To a layman, otitis media means he thinks that you are just speaking gibberish. What is otitis media? And otitis media simply means ear infection or middle ear infection, because otitis means ear inflammation, while the media means middle, meaning infection or inflammation of the middle ear. Many won't know that they had experienced it in their life because it had happened when they were toddlers, baby, children, and infants. Why does it affect mainly children? when you look at the setup, according to medicinenet.com, the eustachian tube is shorter in infants, in children, and more horizontal. And when you now look at that picture, that at that stage, when it's the eustachian tube is shorter, the closest is the pharynx, and since the tube could allow bacteria to pass through and is very short, you can imagine how the resident bacteria, especially after the child has experienced cold or during the winter when there's serious cold or even viral infection, these bacterial residents there can easily have their access to this area, very fertile area, for them to now produce pus and cause this otitis media. Because also reason that the immunity of children are immature at that level. They don't have strong immunity. There is also the fact that adult eustachian tubes are longer. That's why adults don't have it. They are longer and more vertical. It's not horizontal. So it's on top. The eustachian tube is on top of the pharynx. So there is no way the organism can migrate easily to the eustachian tube and into that area of the tympanic, the membrane, the eardrum. This is the picture of the eardrum. You can see the middle ear is around this area, and this is the eardrum. This is the eustachian tube, which would allow bacteria to colonize this area, and that by making it difficult for this drum, the eardrum, to vibrate easily, and the children hear whatever you are saying. So it will affect them mentally too, intellectually. The normal eardrum you can see, and you can see the bulging in acute otitis media because of the pus. This picture shows very well. This is the eustachian tube, and you have the pus around this region. This is the tympanic membrane, which will normally bulge out. That is the bulging out you see, instead of being this way, and it can easily vibrate with sounds, and communication is very easy. The external auditorial canal is this way. Three main types of otitis media that you can categorize is the acute otitis media, the otitis media with effusion. That is very difficult. At times you don't see any bacterial organism there. And the chronic otitis media, which lasts for months, and eventually you may need surgery, you may need to drain, and all stuff like that. The swimmer ear problem is classified as otitis externa, so it affects the external ear, so it's not considered amongst the otitis media problem. The sign and symptom in children and even adults is fever. The children usually prefer come to the hospital. We bring them to hospital for fever, being feverish, ear pain, feeling of fullness in the ear, post discharge, and so on and so forth. The causes of otitis media is as littered. Age and decreases by 6 years. Once somebody gets to 6 years, the explanation has been given. Breastfeeding as against bottle feeding. The gender, it is high in male. Socio-economic status. Caucasian Native American Indians experience it more. Children with cleft palate and other cranial anomalies experience it more. Higher in white than in blacks. That's one of the advantages of being black. Higher in winter, during the winter season, than in spring season. The risk factor continues. The host risk factor includes age. I have told you that by 6 years of age, you don't really experience it, but almost everybody has experienced it at the younger age, 3 months, 6 months, 1 year, and so on and so forth. You can even experience repeated recurrent otitis media. That's true. Prematurity, a child that is born without full term, that is under 9 months. Race, Australian Aboriginals, environmental risk factor increases the risk of infection. The upper respiratory tract infection could increase the risk. The seasonality, which we mentioned, winter, Daycare. When you find children in their daycare, they are not at home, this usual space is not there. They mingle with all kinds of children. Family size is also like the daycare. Exposure to cigarette smoke in that environment is toxic. Breastfeeding, pacifiers at socio-economic level. Here we come into the laboratory diagnosis. You can see the microscopy, biochemical and serological tests to identify what is there, what you have cultured, and then the sensitivity to know the antibiogram. The picture of the microscope to do microscopy. We also have the gram staining, which will show you gram stained organisms. These are Staphylococcus aureus, and the plates. These are plates for also culture. The organisms looking like Neisseria, untreated, and this is the sensitivity plate to show the antibiogram. The PCR machine is the display here, polymerase chain reaction machine, and then we go on to finally the prevention and control. How do we prevent it so that our children will not have it? Well, this is the opportunity. Pneumococcal conjugate vaccine has emerged since 2000, so that could also be given. Ensure child receive annual flu vaccine. I've just mentioned that children who have this infection, the upper respiratory tract infection, will follow or usually progress to have the otitis media, whether treated or not. Sustained breastfeeding for 6 months. This helps to build the immunity of the child, and so it's like you have helped the immunity to really help the child withstand the problem of otitis media. If you find this very interesting, you should just subscribe. Click the like button. Avoidance of tobacco smoke exposure. The environment becomes so smoky, and these children, they get to develop otitis media. That's part of the prevention, so you avoid that. So click the like button, subscribe, and for sure, you will always meet me and yourself enjoying the better life.